nipple discharge. A lot of times patients come with a lot of apprehension to you. Doctor, this nipple discharge, is it benign? Is it malignant? Is it benign? It is malignant. Because lay press reports a lot of writing, and sometimes it is good, but sometimes it can scare the patients. So you must be doubly sure. Physiological is a non-spontaneous bilateral arising from multiple ducts is physiological discharge, nipple discharge. Whereas spontaneous unilateral arising from a single duct is basically considered to be pathological discharge, is what you have to basically remember. Coming to the fat necrosis, in case of women, you require a biopsy to make a diagnosis. Trauma can be responsible. Now, omphalocele versus gastroscus, you must know the differences. So, the most common congenital anomaly associated is basically the cardiovascular abnormality, not neural tube defect, is what need to be remembered. Beckwith-Wiedemann syndrome can be associated with the omphalocele, and I'll leave the literature for you. Omphalocele male to female ratio is 1.5:1, whereas it is equal in gastroscus. So all these differences, which this is one of the high yield topics, omphalocele versus gastroscus. Any entrance you go, it is being asked. There's an abdominal distension in this child, and there is a drooling of the saliva, which is a tracheoesophageal fistula with a esophageal atresia. So now what are the important features? You cannot pass the Ryle's tube because of the esophageal atresia. There is a drooling of saliva, and it can be part of the vacteral abnormalities, where TE means tracheoesophageal fistula. You have vertebral anomalies, etc., in the vacteral. Now, what you are seeing is a hypospadias. So, typically the chordae, is it on the dorsal or ventral aspect, you must be sure. Epispadias versus hypospadias. It can lead to penile torsion, that is the true statement. Bronchogenic cyst is more often middle mediastinal or sometimes posterior, but not anteromediastinal mass. So what are the 4 A's you need to remember about middle mediastinal mass? A for adenopathy, A for awful primary neoplasm like tracheal or esophageal. Aneurysm, because aorta is in the middle mediastinum, and abnormalities of development. What are the 4 T's for the anteromediastinal mass? T for teratoma, T for terrible lymphoma, T for retrosternal thyroid, and T for thymoma, you have to be sure about. So this is how a bronchogenic cyst with the air fluid levels with typically seen arising from the middle mediastinum. Now when the patient is in a comatose stage, head end elevation, not the bed end elevation, is the one which is basically done, which you need to remember. Pyomyositis, Staphylococcus aureus is the most common organism. PSA is no more considered diagnostic for prostate cancer. If it is more than 10, only it has got a higher amount of specificity but no sensitivity. That is a whole problem with PSA. Patterson-Kelly syndrome, it's more common in the female. A female presenting with nail-shaped, spoon-shaped nails, with dysphagia, echlorohydria, classical clinical vignette about Patterson-Kelly syndrome. Beckwith-Wiedemann, what are all the features? There's a macroglossia, enlarged adrenals, ear creases, omphalocele, kidney abnormalities, the combination which is called Beckwith-Wiedemann. Coming to the electrocautery, cutting has higher voltage than coagulation is what you have to basically remember. Now, the pain, nausea, vomiting, they're all considered to be the common post-operative symptoms is what you need to remember. Patient is having a pulsating mass lesion. What is this? Aortic aneurysm. So, aortic aneurysm is more common infrarenal, not suprarenal. It can present like a pulsatile abdominal mass, but very commonly elderly people, it is due to atherosclerosis, and patient is asymptomatic, and you may find the presence of an aortic aneurysm if you do an ultrasound in a completely asymptomatic patient. As an incidental finding, you will come across the aortic aneurysm, especially in the elderly people. Atherosclerosis is considered to be the most common cause. So with this, we come to the end of today's review, doctor. And to all the 17 of you who had been watching, many thanks. And we maintain this habit of every week 300 marks grant test with a review and a discussion. And please tell all your friends also to download the UMedico app. In the new version of the UMedico, we are coming up with quizzing, betting. Quizzing, betting. You'll have 10 questions on every high yield topic in each quiz. You can, midnight also you woke up, okay, let me have, who is the guy who is ready to fight with me on lymphoma? So you clicked on the button, then it will search who else is also looking for fighting on the topic of lymphoma. You both can enter into a quiz and the time clock starts, and then you can start answering. End of the game of 10 questions. If you win, you get points, and your level of expertise will increase. You can review those questions later. You can even chat with that guy who fought with you. So that is how Spardhaya Vardhate Vidya. We are introducing the 10 question wala multiple quizzes on high yield topics, and betting with the friends is going to be the new feature in the UMedico app. So getting released on June 15th. So please download the UMedico app and be part of the preparing community of the NEET PG aspirants. Thank you.